Alright, so today we'll be inserting a Foley catheter. Before I enter the room, I would verify my provider's orders, gather all of my supplies, and then I'm ready to go in the patient's room. I would knock. Hello, my name is Catherine. I am your student nurse today. The doctor has ordered to insert a Foley catheter. That'll go through your urethra and into your bladder. We'll go ahead and position you. So I would do hand hygiene. And before we do the Foley catheter, we're going to go ahead and do perineal care. We'll put our gloves on. Position the patient. So we'll kind of lay you in a semi-Fowler's, a little lower than semi-Fowler's, just to kind of make it a little easier on you and also on us whenever we insert the Foley. Go ahead and kind of get your legs open just to kind of have a space for our sterile field. So I would raise the bed up to working height, kind of like in a little close to my hips. And so we would do perineal care, clean the patient up. Once we do that, go ahead and take our gloves off. That'll be in the trash. Hand hygiene. Alrighty. This is a 14 French Foley catheter. Go ahead and take my supplies out. Place this over here. I will use this as my little test bag. Okay. Alright, so whenever I open this, this is a sterile field, so I want to stay in that 1-inch margin. And if you can be as still as possible, just so we don't contaminate our sterile field. Alright, so now I'm going to go ahead and get my sterile gloves. Kind of shift that way. Same thing. I want to stay in that outer margin. Making sure that I'm only touching the inside of the glove. Alrighty, so now I'm sterile. I do not want to even face away from my sterile field. Alrighty, go ahead and put this straight. We usually use this straight for a male. We'll put that to the side. And then we'll go ahead and grab our drape. Alrighty, we'll place this over here. Right here. Alright, and I'm going to go ahead and grab, all of this is still sterile. Go ahead and grab this, place it over here. Alrighty. Put that away. Alright, get the jelly, spread it in there. Go ahead and open this, clean the perineal. I'm going to go ahead and put this over here, make sure that the bubble is working properly. Check and see the bubble is working, little balloon is working properly. So I'll have that ready. Gonna go ahead and place this in the jelly, about 1 to 2 inches. Make sure it's lubricated. I'll leave that there. Alrighty, so this usually has it has the 3 swabs. So what I'll do is I will go ahead, I have the 3 swabs, go ahead and spread open the labia and look for my urethra. I'll clean one swipe with each swab. One on the right side, one on the left side, and then the center. Okay, so my right hand is sterile. I'm sorry, is not sterile anymore, but my left is. Alright, so we will go ahead and start entering the urethra. Just kind of bear down. Alright, now 2 to 4 inches. Now I want to advance a little bit more until I have urine come into. Alright. And it looks like I do have urine, so I'll hold that in place. Inflate the balloon. Okay. I will disconnect this. Put that to the side. And back. There's some resistance. I will go ahead and put the securement device on the leg. Little leg strap. Once that's in place, we will place this on the frame of the bed. We do not want to put this on the side rail. And make sure that the urine is going through. It is yellow, clear. And usually this should help the patient, give them some relief. Go ahead and I would clean my area, throw everything away. Sometimes I would have to sometimes I would measure the urine depending on the physician's order. Alright, so this concludes the Foley catheter insertion and hygiene. Alrighty, and we have the patient laying comfortably. We would have all of this cleaned up. Alright, and all this will be in the trash. Alright, so we'll be back to come and check on you. Alright, so once I'm done with the Foley catheter insertion, I would document it. It was a 14 French Foley catheter. The patient tolerated well. There was clear yellow urine. It did not seem like it had any sediment or anything like that. Didn't have any foul odor or anything like that. And I will continue to monitor the patient.